Hi, I'm Dr. Huffman with Mounds View Chiropractic. In this video today, I'm going to be discussing a new technology that we're using in our office to evaluate patients' nervous systems as well as their cardiovascular health. The technology is called TMFLOW, and what it's comprised of is 4 blood pressure cuffs, a heart rate monitor, and an oxygen monitor. And these devices are all monitoring patients' vitals as we have the patient performing different tasks. What that allows for us to do is get a thorough assessment of how that patient's autonomic nervous system is firing, as well as what their cardiovascular integrity is. The autonomic nervous system is the part of the nervous system that's controlling all the things that you don't think about. So your breathing, your heart rate, your blood pressure, your digestive health, these are all things that are regulated by the autonomic nervous system. If you've ever stood up too quickly from a chair and you feel lightheaded, that is an imbalance that's occurring in your autonomic system where you're not shunting oxygen quick enough to the brain and you start feeling like you're going to pass out or faint. This test allows for us to take a deep dive into the balance of that autonomic nervous system and figure out why that's happening. You see, you can have imbalances in the sympathetic nervous system or in the parasympathetic nervous system. The sympathetic nervous system is that fight or flight response, that emergency system in your body. The parasympathetic system is more of the rest and digest system. It helps optimize digestive health, helps optimize heart rate and breathing in a normal, healthy environment. And there's this constant back and forth within your nervous system that's supposed to happen. If that's not happening in a balanced manner though, we get different types of symptoms that can be balance issues, can be a racing heart symptom, can be fatigue, can be lightheadedness. This test allows us to take a good look at that and figure out exactly what's going on with that within that autonomic nervous system that's creating these symptoms for you. The other benefit of this test is it takes a deep dive into cardiovascular integrity. So it will measure things like your compressibility of your blood vessels. It'll look at arterial tension, so it'll look at stiffening of the blood vessels and tell us if you're having stiffening of your arteries, which increases blood pressure, increases risk for cardiovascular events. So it takes a really good, clear picture of what's going on within the blood vessels as well. And then we can put together strategies to help regulate your autonomic nervous system better based on this information, as well as we can do different lifestyle changes, nutritional changes, exercise changes to help improve cardiovascular integrity where it's needed. This is a test that I'm running every day on our patients in our office. We've seen amazing changes in patient scores on this test. The beautiful thing is we can do a pre and post, so we can make sure that not only are we finding what's going on, but that we're actually correcting the underlying issues. If you have dealt with any types of these symptoms that I'm discussing, autonomic symptoms, or if you know that you've had a history of some cardiovascular issues, this is a great way to dive deeper into that and see what you can be doing to help improve those parameters. So thanks so much. Give us a call if you have any questions.